It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019 COVID-19.
Thank you. I believe we have Dr. Dovernoso available.
Yes, good afternoon, Chair Nelson and members of the board. Madam Clerk, may I have my slides? My briefing this afternoon is primarily an update on our COVID-19 data. Joining me for this afternoon's briefing is Dr. Henning Ansorg, our County Health Officer. Next. To begin, this graph describes our case rates by vaccination status as of August the 20th. The gray line here in the middle is the countywide case rate at 21.9 per 100,000. But when we drill down, the red line at the top shows that the rate is 37.8 per 100,000 among unvaccinated individuals. And the blue line here at the bottom shows a low rate of 7.5 per 100,000 among vaccinated individuals. So as of August 20th, cases were 5.04 more times likely to be unvaccinated than vaccinated. And in addition, if you look at the three trend lines, we are seeing the cases trending downwards for vaccinated individuals and trending upwards for unvaccinated individuals. Next. For August 30th, we reported 99 new cases, which is lower than the 2-week average of 118. We reported 1 new death. The individual was someone 50 to 69 years of age from Santa Maria. Our active cases stand at 633, with 72 hospitalized. Of the hospitalization, 22 are in the ICU. We have a total of 39,118 cases and a total of 476 deaths. Our case rate as of August 26 is 19.8 and testing positivity is at 6.2. Next. Our hospital capacity has slightly improved this week. So we went from last week with 67% hospital beds in use to 65.8 in use this week. Our staffed adult ICU bed capacity also improved this week, with 79% of staff ICU beds in use last week to 69.7 in use this week. So that's a decrease about 12% of ICU beds being used. Next. As of August 29th, we have 64.9% of eligible Santa Barbara County residents fully vaccinated. So what this means is that there are still about 134,714 eligible Santa Barbara County residents that are not yet vaccinated. So roughly 1 in 3 eligible persons in Santa Barbara County is yet unvaccinated. And this is a slight improvement over last week, which stood at 64%. Next. I'd like to share with your board again the vaccine accessibility in our county. We have plenty of providers, pharmacies, hospitals, public health fixed site, as well as public health mobile vaccine clinics in the north, in the middle region of our county, as well as in the south region. So in total, access is not an issue anymore. And I'd like to remind the public that vaccine appointments are available at myturn.ca.gov or visit our website, publichealthsbc.org, for that link. Next. This is a chart to update your board on the activities of our mobile vaccination program. So as you can see, this past month, we've had about an increase in the number of first doses being requested at our mobile vaccination clinics. 4 weeks ago, on week 17, we gave 56 first doses compared to week 20, where we gave 125 first doses. We have been going to, for just this last month, we had 16 clinics, close to 600 vaccinations given. We went to 5 public community events, 4 low-income housing complexes. We were at 3 schools, we were at 2 work sites, and we were at a long-term care facility. And when we are requested, we will partner up with community sites to make the vaccine happen. We gave in the last month 9 clinics in the North County, 2 clinics in the Mid County, and 5 mobile clinics in the South County. Next. This chart is a summary of what we are planning, the 3rd dose and the booster dose. And this gives a nice comparison when we reference 3rd doses versus booster dose. So the 3rd dose is for immunocompromised population. The booster dose is for everyone who has received 2 doses. The reason why the 3rd dose is being given is because the immune system for immunocompromised individuals are not at sufficient level with only 2 doses, whereas the booster dose for the general population has reached sufficient level with the 2 doses. With regards to the 3rd dose, the 3rd dose brings the immune system of the immunocompromised individuals up to a sufficient level, whereas in the general population, the booster dose boosts their immune system because the immune response wanes after a certain amount of time. For immunocompromised individuals, they are able to receive the 3rd dose after the 28th day after the 2nd dose, and it is available currently. It received EUA after August the 12th. With the booster dose, individuals will be able to receive it 8 months after the 2nd dose, and it is tentatively scheduled to begin on September 20th. Right now, only the Pfizer and the Moderna vaccine has been given the EUA for immunocompromised individuals. And the FDA is pending review of the Pfizer and Moderna for the booster dose. Immunocompromised individuals can get their 3rd dose with their providers at hospitals and at pharmacies, whereas the booster dose will be given by healthcare providers at hospitals, healthcare providers, healthcare workers at the hospitals, in pharmacies, as well as in various community sites given and provided by public health and our community partners. Next. I'd like to end with just a brief update on our current outbreaks. Currently, this week, we have 63 active outbreaks that we are monitoring, 12 among businesses, 21 among schools, and 30 among congregate living facilities. And with that, Dr. Ansork and I are available for questions.
Right. Supervisor Lavanino.
Thank you, Mr. Chair. Dr. Reynoso, just curious about whether or not in the last week or two, it was hard to see on that slide, and I know you were talking about the mobile clinic seeing an increase in vaccination, but are we seeing an overall climb at all since FDA approval?
Supervisor Lavagnino, through the chair, we are looking at that data. Anecdotally, we are seeing an increase when we look at zip code data, but we are not finished with analyzing the data and anticipate that the next time we come back to the board, we'll have a more robust analysis of the impact of the FDA approval.
Okay, thank you. And then I think you said 65% or close to that 66 have had fully vaccinated, but on our webpage, it does show just under 75% have actually received at least one shot. So what kind of outreach, or is that just the lag between a first shot and a second shot, or what are we doing to encourage folks to get that second dose?
That is a lag. There's a lag of 3 weeks between the first and the second dose. And then some individuals may also postpone getting the second dose. So the lag could be even longer than the 3 weeks. And part of our outreach efforts, we are in combination with what our comms team is doing with pushing out that you need to get the second dose. Our community partners routinely will sign people up and continue to not sign them up after the first dose, but will loop back and communicate the second dose as well. So in our vaccination clinics, we are giving not only the first, but the second dose.
All right, thank you. Any other questions from the board? I've got a question for Dr. Anzorg. There seems to be a conversation going on right now, especially with the need to wear masks, whether you're vaccinated or unvaccinated. And I think there might be some confusion. You can help clarify. So if you are vaccinated, you still have the same or potentially the same amount of viral load if you contract COVID-19. Is that correct?
Well, we don't know for sure. That's the honest answer. We go what we call the poor man's viral load is the CT value of the PCR test. It does correlate to the viral load, but not perfectly. So there are some questions about just taking that for granted that it's equivalent to a viral load. There were studies where they actually did measure the viral load, and it was not equivalent. So it's not a perfect solution, but it's the easiest way to go. Now, taking into account that a vaccinated person who gets infected, so a breakthrough infection, can spread the virus, for all intents and purposes, that's what we have to assume with the data that's available. Fortunately, they will not shed the virus for as long as somebody who doesn't have the vaccine.
Can you give me maybe a scale on that? So would they spread it for 3 days versus somebody spreading for 7 days?
Yeah, exactly. They might spread it for 5 instead of 10 days.
Okay, so about half as much. All right,
Yes.
I think that's just good information to get out there that might take place. And I guess there might be some concerns with that as well, since those people who are vaccinated, that they're often asymptomatic. Is that correct?
We do not know for a fact. Honestly, we don't know. It's very difficult to know, because if somebody is asymptomatic and they're vaccinated, the chances are it's very unlikely that they get tested. So it's very difficult to say how many or what percentage is asymptomatic.
Right, Dr. Ansorg, that's very helpful. Thank you. Supervisor Hartman.
That brings up a question in my mind. So if you have been vaccinated and you test positive, would you have a shorter quarantine than if you haven't been vaccinated?
If you're a positive case, you have to isolate for 10 days, regardless of vaccine status. Now, it varies if you're a contact, but if you're actually the patient, you have the virus in you, you can spread it, and therefore you have to isolate for 10 days.
All right. Thank you. Any other questions from the board before we go to public comment? All right, seeing none. Madam Clerk, do we